Would you like to know if possibly you were already exposed to the coronavirus? Antibody testing is ramping up, and I'm joined now by Dr. Eric Walsh. He is the medical director of Hartford HealthCare Go Health. Thank you so much for being with us, doctor.
Great to be with you.
You can go online. You can make an appointment. Basically, anyone who wants to right now can get this antibody test. Is that a good thing, and should people get it?
It's a good thing for a couple reasons. I think if you step back away from the virus itself for a second, one of the things that the medical literature, and I think all of us in society kind of recognizes, there's a lot of anxiety around this virus. This will give you some idea as to whether or not you may have already had it. It doesn't predict specifically whether or not you're immune, but obviously if you have antibodies, it would suggest there might be some immunity, and we'll wait and see what the science says on that. But I think for a lot of people, it's the peace of mind. If they have no antibodies and they have a negative coronavirus test, they probably never had it and are probably still susceptible. So from that side, it helps. On the other side, if you have the antibodies and you had a positive test, you probably have some immunity and you had the disease. If you're someone of those people that fall in the middle, the best we can say is for all of us, you're going to have to keep doing social distancing, washing your hands, wearing your mask. There's nothing so far that would stop you from needing to stay safe and protected.
So let's say you're asymptomatic and you go get this test and it shows you have the antibodies. What does that really mean, and would it change your daily life as far as how we're supposed to be safe?
It would not change how you're supposed to be safe. What it would mean, though, is that you could have very likely had an asymptomatic case of this virus. And we know 25 to 50% of people who get it actually don't have any symptoms at all. And so you may be one of those people who had it and didn't get symptoms and developed antibodies, which again might mean, we'll learn more as the time goes on, might mean that you have some immunity.
And we don't really know that if you can get this virus a second time. I guess we're assuming that you might not get it as badly if it behaves like most viruses, but we don't really know if you might just get infected again.
You might get infected again. But to your point, if you ever got the chicken pox the second time after having it the first time, it would be very mild the second time. And so we would imagine, I mean, again, just based on what we know about even from SARS a couple of decades ago, that you would get some immunity. SARS gave like a year's worth of immunity if you had the SARS from back in 2002. And we would assume that this would give you some immunity. And that if you did get it again, you'd get it more mildly because you would have some antibodies to help you.
Yeah, so if we are able to get the test, and I know if you're insured, it looks like it's very low cost or even free. If you want to pay for it, you can order it on the website yourself. We're talking about the one that Go Health is putting out there is the Quest Lab test, I understand. How accurate is it?
It actually has very good sensitivity and specificity, like 97 and 98%. So it's very accurate. Obviously everything comes with a few caveats, and one of them, of course, is technically there are some other coronaviruses that exist that you could have had that isn't exactly the coronavirus, the COVID-19. But in general, the reality is if you get the antibodies to this in the middle of a pandemic, you probably had the coronavirus.
So for those who are joining us on Facebook, I want to let people know that they can ask you questions as well. As a journalist, I always like to know more information than less. So I'm thinking, hey, I want to get this test. I just want to know if I have anything. But I understand, I guess I just can't change my life, regardless of what it says.
Absolutely. And I'd actually encourage people, especially if they're curious, to go ahead and get the test. There's no rush to get it. So you can go onto our website, Go Health UC, Go Health Urgent Care, gohealthuc.com/CT for Connecticut. And you can actually reserve a spot at any of our 13 centers that are open right now. And you can come in and have a quick visit with one of our providers. They'll take your vitals. We want to make sure you don't have a fever. And then we'll order the test, we'll draw the blood, and you'll be on your way. And so far, within 24 hours, our partners, Quest, have been able to get people the results. And as long as you have MyChart Plus through Hartford HealthCare, the results will you'll actually get an email with the results. And then we'll talk to you if you have a positive result.
We have a question of, is it free? And at least from when I looked on the website, at least for those who are insured, the insurance is supposed to pay for it?
The insurance is covering this as a coronavirus-related test, so there's no copays. And if you have Medicare or Medicaid, it's no cost out of pocket as well.
And if you're someone who doesn't have any of those things, you can buy the test for about $100, I'm told.
Yes. And we've been working with Quest, so even right now, that might actually be less. So you'd want to call into one of the centers and find out where we are with the pricing, because we have been trying to get the price down as well.
So we also want to be clear to people, if you're feeling sick right now, you don't want the antibody test. The antibodies are something that happen in our body after we've already recovered from something. So if you're feeling sick, should you just get the regular coronavirus test?
Yes, you should get swabbed. And we have 3 centers in the state that are doing the swabs as a drive-through, one in South Windsor, one in Avon, and one in New London. And you can do that through a virtual visit. You don't even have to come into the center. You can go onto our website, sign up for a virtual visit. They'll order the test. You go through the drive-through, they swab your nose, and you keep going. There are a few people that sometimes you need to give both tests to. There's some people who are really sick, let's say in February. Let's say they were down for like 6-7 days with a really bad flu-like illness, shortness of breath and all of that, and then they got better, and now they're sick again. Arguably, they could have had the coronavirus before and have something else now, or vice versa. So getting both tests might actually be beneficial to make sure you are not acutely infected with the coronavirus. And at the same time, to see if possibly when you were sick before, maybe you had it then. So there are a few people who might fall into that category.
If people are feeling sick right now, I had a friend ask me that the other day. She had a sore throat, she had aches, she felt like she had the flu. Is it likely the coronavirus, or could it be the regular flu right now?
Could absolutely be the flu, could be a myriad of other respiratory viruses, RSV. There are a ton of other viruses besides influenza and coronavirus. So there are other viruses that could cause you to have those types of symptoms. And here's the truth. I mean, when we look at it, even through, as we start testing more, a lot of people are going to be surprised that they're sick and the test comes back negative. You repeat the test, it comes back negative again, and you had something else. Before this coronavirus, people got sick with flu-like symptoms, by the droves. Our volumes go up every January, February, and March because of the flu season. So there are a lot of people who don't have the coronavirus who do have symptoms. But of course, again, I want to speak a little bit to the kind of mental health component of this. This is very high anxiety. So getting tested to know what you have and reduce some of that anxiety around it. Because if you have it, you'll feel a lot better being isolated and quarantined to not expose others. And if if the test is negative, you'll feel better knowing you're going to get better from this. It's not the coronavirus. And like most of these upper respiratory viruses, you'll just get better all by yourself.
Okay, so let's go back to the antibody test now, because I know more people have joined the feed and they're wondering how accurate it is. Again, it's a new serology test. It's going to be a blood draw. They're not going to just prick your finger, they're going to take the blood. But you're saying you are seeing some of it being pretty accurate, up in the higher 90s percentage-wise. So let's say you get the antibody test and it says you're positive, you have the antibodies. Does that mean you can go visit your elderly parents?
It doesn't mean you can visit your elderly parents without all of the kind of protections you would have taken anyway. We know that if you wear a mask and the other person wears a mask and the two of you are in a room, you reduce the chance, even if one of you has coronavirus, there's a significant reduction. I mean, with no masks on, you're at 70-something% chance you transmit it. It drops down to 1.7% chance. So there's no reason to take that risk with your elderly parents, regardless of what the antibody test shows. So if you have antibodies, right now what we know is it means you might be immune, which means you might be less likely to spread it. But we don't know that for sure yet. So if you're going to visit your elderly parents, you might have a little more peace of mind if you know you had the antibodies, but you should still take all precautions.
So just for clarification, we have some folks asking, how do we order this test? What are we asking for? You would be calling your doctor, or again, this is pretty easy. You could just go to the urgent healthcare centers, the Go Health urgent healthcare centers. They're all over the state. There's a website, and you would ask for the coronavirus antibody test.
Absolutely. So what you can do is go on our website. We have a program called that helps us to schedule patients. And it's not a true schedule. We just kind of reserve a spot because we do take walk-ins. So if someone comes in more sick, sometimes they jump to the front of the line like in an emergency room. But you can go online, reserve a spot. For example, let's say you're in Southington, Connecticut. You can actually go on, reserve a spot at our Southington clinic, and then you can go in and you can be tested there. And it'll be all very quick, very easy, and we do our best to reduce, contact between patients and everything. So it is a very easy system to set up. If you need to Swab test, you can do a virtual visit, have that ordered, and again, just drive through an Avon, South Windsor, or in London.
And the swab would be if you're actually sick. We want to stress that you don't want people who might have coronavirus going to these urgent care centers. They are making sure that sick people don't come in. This is just, you might be feeling fine. You might just wonder, you were sick a month ago, and was that the coronavirus when you couldn't get a test back then? So this antibody test is really more for information. How much of it is it important just for the idea of tracking this from an epidemiologist way? I mean, are we getting this test and then helping the state track where it is?
The test results will be reported to the Department of Public Health. And in the big scheme of things, that it will be one of the things that will help us down the road as we begin to come out of, the kind of our current lockdown situation. Because as we know more and more people have antibodies, it is far more likely we'll be moving towards herd immunity, which is ultimately what will save us in this situation.
Right. There's some talk about, we learned from the Spanish flu, herd immunity. And way back when in history, people had immunity cards and things like that. We're not there yet, right? People were waiting for this antibody test. They were excited. You're not going to walk out with some immunity card like, I get to go back to work. I get to be on the front lines. I'm safe now.
No, not yet. And remember, the information is changing very rapidly. So the good news is there are armies of scientists around the world working on this. In a week or two, we may know a lot more about what this antibody means. Right now, what we know is you cannot, put a badge of honor on yourself and say, look, I'm immune. I can just go out and breathe the coronavirus air. I can go mingle in large crowds, because we don't know enough yet to give that green light.
I know our time is running out. I want one quick question because there's someone on the feed. Can children get it? Are there pediatric tests for children?
I would reach out to your pediatrician. Our test, we're doing the antibody test currently 18 and over.
Okay.
And so the pediatricians, if they're going to be tested, it would probably be done with or through some of the pediatric offices in the state. That may change again, and we may expand our capacity and go down to 12 years old. For the nasal swab, for the acute illness test, it is 12 and over.
Okay. Thank you, doctor. Just for those wondering, I know in New York, I do know some children who were tested, but remember, it is a blood draw, so you'd have to have lots of lollipops. But thank you for being with us, doctor.
All right. Thank you.